Noon or morning, depending on where you are. We have people calling in from across the nation, and welcome to this web briefing. I'm Bill Kramer, Executive Director for Health Policy at the Purchaser Business Group on Health. Our new name, many of you have known us in the past as the Pacific Business Group on Health. We're going to present and discuss the results of a new survey of business leaders and how they view rising healthcare costs and the role of government in containing costs and providing coverage. This initiative was spearheaded by PBGH. We believe that there was a gap in survey research about employer attitudes. In the past, nearly all employer surveys were conducted with benefits managers within large employer organizations. In contrast, this survey is, we believe, the first to tap into the opinions of business leaders, the C-suite, CEOs, CFOs, and so on, the ones who make the ultimate decisions for their companies on employee benefits and public policy. To conduct the survey, we reached out to partners, including the Kaiser Family Foundation, Beresford Research, and the West Health Institute, and we are grateful for their collaboration and support. I will now turn this over to Tim Lash for his introductory comments. Tim is Chief Strategy Officer and Executive Vice President for West Health and President of the West Health Policy Center. Tim?
Great. Thanks, Bill. And happy Thursday to everybody. It's a privilege to be representing the West Health family of organizations. I'll be brief, but it's important, I think, just to ground everybody on, who we are and how we think about things. West Health is an umbrella of several nonprofit, nonpartisan organizations that are dedicated to lowering healthcare costs. We approach the healthcare conversation by using a unique blend of applied medical research, policy analysis, and outcomes-based philanthropy. And for several years now, we've been advancing a body of work to measure public opinion and track the impact of rising healthcare costs on the general public, really in an attempt to give voice to their concerns and their experiences with the healthcare system. And that's particularly needed given the experience that families and consumers have had just over the past few years, or just over a year now. However, we recognize that the impact of high costs are not just felt by the consumer. They also impact business. And that's why we were so proud to support the Pacific Business Group on Health and the Kaiser Family Foundation's work here on exposing how large employers view rising healthcare costs. And I think we're at a very interesting time in the discussion of healthcare costs and cost containment because there's growing broad support. In this instance, what is good for business is also very good for consumers. We know that the current path of our healthcare system has headed down, a track that is, simply unsustainable. Every hour we spend some $420 million on healthcare. That's crazy to think about, and that number is increasing with every minute. And there is ever increasing costs that are a dragnet on consumers, families, and businesses alike. And I think when you sort of really get into the numbers, for decades, the high cost of healthcare has depressed individual spending power and has also become, as many of you know, an ever increasing burden for employers. And, to put it frankly, employers are just currently getting a raw deal when it comes to health spending. They're paying much higher prices for healthcare goods and services than the public plans. And in fact, by 2040, employers are expected to spend some $2 trillion on healthcare annually. And, for every dollar spent on healthcare, it's one less dollar available for wages, investments, and other businesses, essential businesses expenses. Employers and employees want the same thing. They want the highest quality, most affordable care that keeps their employees and families healthy and unburdened by cost. And in the wake of COVID-19, we could be on a cusp, we believe, of meaningful action to lower costs. And the consensus is clear. There's broad support for greater involvement by the federal government to step in and lower these costs. We heard that last night, in fact. We see support is coming from all angles, from employers, from patient groups, and from all sides of the political spectrum. Everyone agrees something needs to be done. And I think that's why this discussion is so timely today, where we'll hear a lot about how employers want to see and what they want to see from the federal government. And as I said, in this instance, what's good for business is good for the consumer, especially at a time when the country is reeling from this pandemic. So I'm very excited to hear today's discussion, and it's a real privilege to be joined by the group that has assembled. And with that, I'll turn it back to Bill.
Thank you very much, Tim. We really appreciate the support and the partnership that you and your colleague Sean Dixon have provided us throughout this initiative. I would now like to introduce our keynote speakers. We are exceptionally pleased to have two congressional leaders who are especially knowledgeable and have paid special attention to the role of employers in providing health benefits. We will hear first from Senator Mike Braun, who has represented Indiana since 2018. Senator Braun serves on the Senate Health, Education, Labor, and Pensions, the HELP Committee, where he is ranking member of the Subcommittee on Employment and Workplace Safety. He also serves on the Aging Committee, the Agriculture Committee, the Budget Committee, and the Appropriations Committee. Prior to his election to the Senate in 2018, Senator Braun was the founder and CEO of Meyer Distributing, an industry leader in auto parts distribution and the third-party logistics business. Senator Braun.
Well, hey, my pleasure to be here. And I'm going to be speaking as much as a U.S. Senator as a former CEO and CFO of a company for 37 years prior to becoming a senator. I'm going to start with a little story to tell you how involved I've been with the subject that you're wrestling with currently. Go back 13 years ago, we had just 300 employees. We were probably in 10 states, 10 locations. I was tired of hearing how lucky I was. My health insurance was only going up 5 to 10%. The only way I could moderate premium increases would be to bring a new underwriter in every 3 years to buy it down. My size group, just large enough to self-insure, but really didn't want to, was a very high profit target for insurance companies. Well, I had enough that day when we were reviewing our plan, and I said, I'm not going to renew the one we've got. What else can you give me? Learned a lot that day. Number one, going to self-insurance, the margin that they were making on companies my size, roughly 25%. I was only spending $1 million per year for roughly 300 employees, maybe half of whom actually used the insurance. Most were young, unmarried males, don't use the healthcare system much. I said, I'd like to find out what else I can do more substantively. They said, well, the biggest driver of your costs is a disengaged employee healthcare consumer. They're interested in not having any skin in the game. I said, tell me more. They said, well, your co-payments, which ours were $10 then for an office visit, prescription, that was costing me 25% a year, $250,000. I said, well, how can that be? He said, well, those average 80 to $100, and that's being paid in the premium when there's a $10 copay. I said, okay, that makes sense. Decided that day to get my employees engaged. And I said, what can I give them in return? They said, you're going to save so much money that you can get rid of co-insurance, the third leg of an insurance plan with deductible and co-payments. I said, what the heck? It's not been working. I'm going to do it. I cut costs 50% out of the gate from roughly $10,000 an employee to around $4,800, 13 years ago. My son, who now runs a company, just reviewed our healthcare plan. We're at $5,400 per employee. We now have 1,100 of them, growing 20% a year. You say that sounds too good to be true? Well, I now have an employee base that is doing everything they can do, like they'd be buying a big screen TV when they engage the healthcare system. Final story, that day we went live, had a guy that was using his copay for a $200 a month medication. He was complaining that's now going to cost him $2,400 a year. With a $10 copayment, it was only $120 a year. I said, did you ever shop around? He very gruffly said, well, why would I with a $10 copay? He made my point. Then I risked to see if it was out there for less money. Took him 30 seconds. He didn't have to go to Canada. He found it for $99. That is now the culture of my company for MRIs, CAT scans, colonoscopies. anything within that $5,000 deductible. The employees go less deeply into their deductible now than they did 13 years ago because they are consumers of healthcare and they're price sensitive. You could scale this across the country. I'm sure you've seen some of the benefits. That's what I'm trying to get Democrats to listen to out here. Fix the system, make it more transparent. You bring costs down for Medicare, Medicaid, the private insurance industry benefits as well. Here's the problem. Hospitals, AMA, pharma, insurance, 4 of the 5 or 6 biggest lobbyists out here. And I thought surely the US Chamber of Commerce would be for free enterprise. They back the healthcare interests. So we're at a really pivotal point. CEOs that don't own a healthcare business are getting sick and tired of being in between their employee and their healthcare. My son, who runs the company, is as conservative as I am, and we are people that take risks and don't accept the status quo. He is just willing to probably maybe go mostly to government unless we can fix it and bring the reins in through transparency, competition, get rid of the barriers to entry, and engage the consumer. Then you've got a free market. What we've got currently is an unregulated utility. So healthcare has the best of both worlds. They're an unregulated utility, and many of my own free market Senate buddies believe they are in free enterprise, which they are not. I'm sure that might generate a few questions if you have any. If it's just for me to tell you where I think the Senate is, we'll leave it at this. We've got a narrow window, and you can see it cascading in front of us politically. If they breach the filibuster, it'll be the Voting Rights Act first, something like the Equality Act and many others. The crown jewel of the other side of the aisle is the Green New Deal and Medicare for All. And once the filibuster is breached and broken and you expend that political capital, we may be closer to the Bernie Sanders system than what you know, because many out in the employer world are getting fed up.
Thank you very much, Senator Braun. We greatly appreciate your comments. Your experience as a business leader gives you a unique perspective on how healthcare markets work and how they don't work, and what's needed in terms of public policy to hold down costs and provide appropriate coverage to employed people and their families. We greatly appreciate your taking the time today.
And we'd be happy to re-engage at any time. It's a complicated subject. And by the way, my company's not had a premium increase in 13 years for my employees, and we cut the family contribution by 50%. So can stew on that, be happy to discuss anything down the road. We need to get going on the subject though. Take care. Thank you.
Thank you very much. We look forward to working with you. We will now hear from Representative Bobby Scott, who has represented Virginia's 3rd Congressional District in the U.S. House of Representatives since 1993. Prior to his service in Congress, he served 15 years in the Virginia General Assembly. Congressman Scott currently serves as the chairman of the Committee on Education and Labor, and he also serves on the Committee on the Budget. Congressman Scott.
Hi, I'm Congressman Bobby Scott of Virginia's 3rd District, and I chair the House Committee on Education and Labor. I'm sorry I couldn't be with you today, but I want to thank the Purchaser Business Group on Health and the Kaiser Family Foundation for conducting the survey on employer views on healthcare. The survey findings further confirm the broad consensus that the federal government must play a stronger role in expanding access to affordable, high-quality healthcare. And more importantly, the survey confirms that this consensus is not only shared by workers and advocates, but also by our nation's employers as well. The committee has worked consistently to ensure that workers and their families get the care they need. Just as Congress, I can share that we've helped millions of Americans gain and maintain access to affordable coverage as we continue to confront the COVID-19 pandemic. Just last month, the Congress passed an historic relief package the American Rescue Plan, which included many of the committee's healthcare priorities. Importantly, it provided workers who had been laid off or subject to reduced hours with premium-free COBRA coverage so that they can seamlessly continue their existing coverage at no cost. Just last week, we joined our colleagues in reintroducing the H.R. 3, the Elijah E. Cummings Lower Drug Costs Now Act, which would rein in unacceptably high costs of prescriptive drugs. Workers and businesses in America should not have to pay 3 or more times more what people in other countries pay for the exact same drugs. By finally allowing the federal government to negotiate better drug prices, H.R. 3 would save the federal government more than $450 billion and increase workers' wages by about $116 billion. These prices would apply to both Medicare and ERISA plans. Simply put, this bill is good for workers, good for taxpayers, and good for business. I want to thank PBGH and KFF for supporting these efforts and for everything you've done to help workers and their families secure affordable care. However, as you know, our work is far from over. In the weeks ahead, we need to continue working to ensure that all Americans have affordable health care they need to weather this pandemic and to stay healthy in the future. Thank you.
Thank you very much, Congressman Scott, for your prepared remarks, and also to Senator Braun for your insightful comments, which I believe will serve as a useful launching point for our discussion today. Before we present the survey results, let me provide a brief overview of the employer's perspective and the policy landscape. First, we know that large employers have become increasingly concerned about the high and rising costs of the health benefits they provide to their employees and families. Large employers are the primary source of private coverage, and thus are important stakeholders who will be influential in policy debates. Their views on health policy issues, however, are largely unknown. Many assume that business leaders tend to favor market solutions and oppose government involvement in markets. But this is untested. Our objective in the survey was to find out what business leaders felt about healthcare issues, especially cost and coverage, and their opinions about potential government actions to address these problems. As we all know, the recent election has changed the political landscape and extended the range of policy options under consideration. As you know, there are proposals that would regulate or cap prices for high-cost drugs. In addition, there appears to be bipartisan support for strengthening antitrust enforcement and limiting anti-competitive actions that are used by some healthcare entities to gain market power and increase prices. Furthermore, during his campaign, President Biden proposed new options that would broaden access to public coverage. One would create a public option that some people could elect in lieu of their current coverage. Another would lower the age of eligibility for Medicare to age 60. Each of these proposals represents an expanded public role for providing coverage and restraining costs for populations that are now largely served by private health plans and self-insured employers. Since these proposals are controversial and likely to face opposition from large parts of the healthcare industry, it's important to assess the level of support among key stakeholders, such as large employers. I will now turn this over to Gary Claxton to present the results of our survey. Gary is Senior Vice President and the Director of the Program on the Healthcare Marketplace at the Kaiser Family Foundation. He and his colleagues have been great partners in designing the survey and analyzing the results. Gary?
Thank you, Bill. I'm Gary Claxton, Senior Vice President at the Kaiser Family Foundation. Next slide, Ashley, please. Next slide. Oh, we're still getting there. I'm going to briefly describe the findings from the survey we conducted with PBGH and with the help from Beresford Research. The survey was conducted in December 2020 and January 2021 with just over 300 senior corporate executives from a convenient sample of firms with at least 5,000 employees. We did not include healthcare firms in the survey. The respondents were chief executive officers, chief operating officers, chief financial officers, chief human resource officers, or their direct reports. Most respondents were the final decision makers at their firms about policies about spending for employee health benefits. Others were key influencers. I think as Bill said, our goal was to elicit the views of corporate leaders about the costs of health benefits and about potential policy proposals around cost containment and public coverage expansions that could affect employer-sponsored health benefits. Next slide. It's not really a surprise that virtually all the respondents agreed that the cost of health benefits is excessive. This is true even though almost equally large shares believe that employers can make meaningful changes to the cost of health benefits, both collectively and individually for their employees. Large shares of respondents also said that they were at least moderately likely to implement a variety of cost containment strategies to control future costs. These included value-based purchasing models, high-performing networks, direct provider contracting, and increasing employee deductibles and contributions. Next slide. Despite these planned efforts, respondents demonstrated a lot of concern about future costs. 87% agreed that the cost of providing health benefits will become unsustainable in the relatively near future, in the next 5 to 10 years. An almost equally large share agreed that this would necessitate a greater role for government in providing coverage and containing costs. Next slide. The respondents were very interested in government interventions that would help with transparency into cost and with non-competitive market conditions. 90% of respondents agreed that the government should pursue policies to improve transparency into prices and into the total cost of care. 92% of respondents agreed government should strengthen antitrust enforcement and prohibit anti-competitive conduct by providers, drug manufacturers, and health plans. Reasonably large shares also showed at least some agreement with more specific proposals that would cap hospital payments where competition is limited, limit out-of-network bills, or negotiate prices for high-cost drugs, or limit drug price increases. Next slide. Respondents also demonstrated openness to proposals that might expand public coverage to serve people now in employer-sponsored plans. Very large shares at least slightly agreed with proposals to lower the age for Medicare eligibility to age 60 and to provide an option for employees to enroll in a new or existing public health program. There was a pretty similar level of agreement and disagreement for these policies as they were applied to the public at large or to the employees of the respondents themselves. We did not provide any details here, so we do not really know how respondents would react if more specific program structures or more fleshed out proposals have been put before them. At the same time, the ideas conceptually did not elicit strong negative reactions. I think we also know that public program expansions have the potential to lower employer or employee costs, and that their views would probably change based on how much that came into effect. Next slide, last slide. Overall, more than 4 in 5 respondents believe that a greater government roles in providing coverage and containing costs would be good for their businesses and good for their employees. This is consistent with the concerns expressed about the future cost of health benefits and with the frustration with their frustration with the lack of transparency in non-competitive healthcare markets. We also saw that many respondents who expressed these views thought that the government could lower their own costs and the costs of their employees. I'm done with the summary. So Larry, I think I'm turning it over to you.
Great, thanks, Gary. We now want to turn to a discussion of what this survey might mean for the coming healthcare debate in Congress, particularly following President Biden's speech last night. We'll also be taking questions from the audience, which you can submit at any time in the Q&A function at the bottom of the Zoom map. We have a terrific set of panelists here today. Lanny Chen is at the Hoover Institute and a longtime advisor to Republican candidates and officials. Chris Jennings is founder and president of Jennings Policy Strategies and has served in 2 Democratic White Houses. And Elizabeth Mitchell is president and CEO of PBGH, the Purchaser Business Group on Health, our partner on this survey. And Elizabeth, let me start with you. As Gary said, it's no surprise that corporate executives are worried about the sustainability of healthcare costs. That's been true for quite some time. I, for one, was surprised by the level of openness among these executives to government interventions, even things like government negotiation of drug prices, lowering the age of Medicare eligibility, or a public option. What do you think is motivating employers here, and how far can we go in interpreting this as a sign that employers might use their political clout to address these healthcare issues?
Great question, and thank you for hosting this really important and timely conversation. You know, I think these results reflect the frustration that our members and other business leaders have. Frankly, they think the healthcare industry should behave like they do and be accountable to their customers. But as you heard Senator Braun say, you know, they're sort of having it both ways. So they are seeking a free market and yet limiting negotiations. And when employers try to do value-based purchasing, they are limited through lack of transparency, through gag clauses and other anti-competitive practices. So they need to be responsive to the people paying the bills. And I think you are seeing the result of that not happening. And, you know, healthcare is not the day job of these employers. They build airplanes, they sell groceries, and they're being somehow asked to fix the healthcare system. So they are looking for the best healthcare at the best price for their employees. And they are not seeing that from the industry. And so they are increasingly willing to look at other options.
Got it. Chris, let me turn to you. So following the president's speech last night, what do you see as the prospects for some action on these issues in Congress? How significant might it be if employers did weigh in with their political clout as a counterweight to the healthcare industry?
Well, before I do my prognostication, Larry, let me just first congratulate Bill and thank Tim for supporting Kaiser Family's extremely timely employer survey. It really is really helpful for us to be contemplating where the employer community is situating itself on this incredibly important issue. And I also want to thank you, Larry, and particularly Gary for his long-term work in this area. So before I start, I just wanted to do a quick shout out on that front. You know, as for the issues on Capitol Hill and their likelihood, they're driven, frankly, by the public's frustration with healthcare, particularly cost and complexity, and the overall issue of affordability. And that is showing up across the board. Independents, Republicans, Democrats, and policymakers are very much interested in responding. And we saw that last night with the president's very, very strong outreach on the prescription drug issue in particular, and linking it to how the dual benefit of its ability both to address the issue of higher drug prices, but its concurrent benefit of therefore automatically lowering premiums and cost sharing, and having the additional benefit of producing savings that can be used to reinvest to lower cost in a whole host of other areas. I think that's where there's some real excitement. There's definitely going to be differences of opinion in the party and on the Hill as to how best to construct that policy, and then how best and where to invest it. But you can tell that there's real excitement in the air across, bicamerally, I hope in a bipartisan way, to begin to address this. And we're noting that Republicans do not want to be opposed to these issues, largely, frankly, because some of their constituencies, and particularly the employer community, is really asking for relief, especially because they feel that there have been some very real market failures that have to be addressed by federal interventions. So, what policy, what legislative vehicle, how it's packaged, when it will occur, I'm not sure I can be that prophetic for you, but I will prognosticate that there will be action, and the likelihood for action is more likely than not.
Thanks, Grace. We'll maybe push you to be a little more prophetic later on in the discussion. So Chris mentioned a hope for bipartisan action. Lanny, you put out a brief this week looking at some of the budgetary effects, the effect on the Medicare Trust Fund of lowering the age of Medicare eligibility. I'm guessing that you don't see a lot of support on the Republican side of the aisle for that idea. And it could frankly even be controversial among some Democrats. But do you see any prospects for bipartisan action on healthcare, and what issues might that be?
No, I think the short answer is it depends. And I think Chris's prognostication skills are unparalleled in the field. So I don't want to contravene his prognostication. I do think there will be a significant amount of public interest in trying to get something done on healthcare costs. And I think the most likely place for that to happen will be around the prescription drug space. Now, the devil has always been in the details here. There was a bipartisan framework that the Senate Finance Committee put together, for example, I guess now 2 years ago, that speaks to some amount of bipartisan consensus around certain kinds of reforms that will help to lower drug costs. And, I think there is an appetite amongst both Democrats and Republicans to act there. So I certainly do see the potential and the possibility for there to be bipartisan action. And the reality is that there's only so much Democrats can do in a unipartisan way via the budget reconciliation process. Even if they have 2 more opportunities this year, I think they have a lot of things on their agenda they want to accomplish even outside the healthcare space. So if they can do drug pricing in a bipartisan fashion, I think they would be, inclined, and it'd certainly be a smart thing to do. In terms of the broader system reforms, I do think there will be a massive challenge around public option proposal. I think the idea of lowering the Medicare eligibility age carries significant political risk, quite frankly. And I think both Democrats and Republicans who I've spoken to in the wake of the paper we released have expressed their concerns about the politics as well as about the wisdom of lowering the eligibility age of Medicare and some of the challenges that come with that, particularly around exhaustion of the trust fund, which we find would be accelerated by any such effort to lower the eligibility age. And I think that goes without saying. Anytime you deal with Medicare and anytime that you begin to encroach on the program, people definitely have something to say about it. So look, I'm pessimistic we're going to see broader reforms. I'm pessimistic we're going to see any bigger movement, but I do think drug pricing is one area that's worth watching. And to Chris's point, I think there's just a tremendous amount of public interest in it. And perhaps more so even once we find our way out of the worst part of the COVID-19 pandemic.
So let's focus in a little
Larry,
bit more.
can I just?
Oh, sure.
Yeah, I just wanted to pile on that this is really not partisan. This is about American businesses and American jobs. We have lost over 10 years of US wage growth to healthcare cost increases. RAND has shown that for every 10% increase in healthcare costs, you lose 121,000 jobs. We are trying to bring back, the US economy from a pandemic. And we know that controlling healthcare costs will enable businesses to grow and to invest in business, in jobs, and invest in their core business. So I really think that the alignment with public interest here is pretty broad. And again, it's not partisan.
So staying on drug prices, the president last night talked about negotiating drug prices in Medicare, but also noted that those negotiated prices would be available to others as well, employers, privately insured patients. So much of the focus in Washington lately has been on drug price negotiation or tackling drug prices in other ways as a pay for, as a way of saving the federal government money to pay for other priorities in healthcare or elsewhere. Do you all feel that this idea of a government intervention to address private sector prices paid for drugs has gotten lost in this debate, or what's the potential for that being a bigger part of this discussion?
Well, Larry, as you know, that part of it was actually incorporated into the House version of their prescription drug policy. They did extend it to commercial, largely because the employer community at the time intervened and said they did not want to see Medicare constrain its costs and potentially shift costs or open up the potential for employers to be more vulnerable to even higher prescription drug costs. I think that message is starting to break through even more so. I do want to highlight one point you did raise, which is, yeah, I think Democrats are making a little bit of a mistake by talking about how they want to spend this money before they talk about how they secure the savings and how they constrain cost. And frankly, that policy is more popular. Prescription drug cost. This is the only time I can remember that prescription, that a cost containment policy is more popular than the policies that you might invest the savings for to spend. It actually, the public is writ large fed up. And as you know, and as I tried to make clear in my opening remarks, the benefit of intervening isn't just that you get savings, it's that you automatically lower premiums and cost sharing because you're lowering prices. And that's what Democrats and anyone who's advocating for drug cost containment, Republican, Independent, purple, green, orange, wants to talk about. They should be talking about that the politics of how those savings are being spent. I can assure you that there will be people on Capitol Hill who will find a way to spend those savings, but that to me isn't the big issue driving this debate.
And Lanny, you talked about potential bipartisan action on drug prices. The negotiations, the discussions between Senators Grassley and Wyden. What are some of those measures that you think could bring, let's say, 10 votes or more in the Senate among Republicans to the table?
Yeah, I mean, I think the idea of there being some shared savings around excessive list price increases, that's something where I think we could see some bipartisan support. There's been, frankly, bipartisan support for some kind of international price indexing. Now, that one gets tricky because the devil is in the details there. But you'll recall famously that former President Trump was the guy who pushed this notion of most favored nation status, which is kind of a cousin to the concept of international price indexing. But enough Republicans, I think, have expressed some interest in trying to look at pricing around the world and how that might impact pricing here at home. Direct negotiation, I think, may be a bridge too far, just because it comes with a historic amount of baggage for a lot of Republicans. Now, the Republican view on this has begun to shift. It is not the same kind of unilateral, absolutely not perspective you would have found, let's say 10 or 15 years ago. I do think there is probably a little bit more openness to it, but I don't think there's enough to get you to the requisite number of senators you would need to forge a bipartisan deal to get it past the traditional cloture rules in the Senate. So if you need 10 Republicans, which is kind of where we are now, it seems to me unlikely that any form of direct negotiation makes it into a final agreement. But as I said, I think there are components of this that could be popular, that could get some bipartisan support, and building off that Grassley-Wyden framework, I think, is the right place to start.
And Elizabeth, you talked about corporate leaders. They focus on their core business. They get up in the morning thinking about what they make, the services they provide, not healthcare necessarily. Thinking about, particularly coming out of this pandemic, with corporate leaders thinking about how to get their businesses back on track, moving their operations more in person. How do you think that'll affect their willingness to engage on these healthcare issues as well?
Well, I think these numbers sort of speak for themselves. This has reached the C-suite as a concern. And I don't know that we could have said that a few years ago. Yes, it was complex and expensive, but this has now reached the CEOs of many major corporations. And I think that is a very important signal that this matters. And, that action really is expected by Congress. And the idea that you wouldn't have federal intervention, we already have federal intervention prohibiting negotiations. Negotiations are a core part of free market. So I really think that there is a readiness to think differently about this. And when you think about if we had only had healthcare cost increase at the same rate of it as inflation, each American worker could have another $450 a month. That is a real stimulus, right? That's not a one-time stimulus. That is a monthly increase for American workers. And again, American businesses and American workers are aligned on this. They need more affordable care. And I think you're going to see a different approach from the corporate sector.
Larry,
Yeah.
just want to say that, and I oftentimes, you can feel the ground shifting a bit, and sometimes Washington is known for its static analysis, which is, we're usually the last to actually reflect where the rest of the country is. And I think right now we're starting to feel that in a significant way. I also just want to make a point, which Lonnie just said something which is absolutely true. Donald Trump was the person in the Republican Party who really embraced this whole notion of the need to deal with excessively high drug prices. I mean, it is a very, very populist issue, and he got that, and he also got this whole international pricing scheme extraordinarily well too. So this idea that this is like a radical concept is kind of, it's a radical concept only in Washington, nowhere else. And let's remember one last thing. And again, Donald Trump, what did we just do with what we talk about and praise the vaccines, right? Moderna and Pfizer, which of course were the outgrowth of significant investments in NIH and the platforms, et cetera. At the end, and after they produced these remarkable vaccines, what did the federal government do? They negotiated a price to ensure that would be affordable to all Americans. The idea that that's radical is sort of crazy. So I'm going to just remind the audience that that's something we've done, and we've done with Republicans and Democrats, and we should do again, because the one thing the employer community knows is the specialty drug prices that are around the country, they're just around the corner, that are already starting to have a big impact on day-to-day premiums of employers, has to be at least looked into, and excesses have to be addressed.
We've been focusing a lot on government negotiation, government intervention. Senator Braun talked about the ideas of transparency. Elizabeth talked about kind of employers wanting to make the market work and inability to do so. Another issue that President Trump put on the table was price transparency. Issuing regulation to require hospitals to disclose negotiated prices. We've done at KFF have done some work lately looking at how well that's really working. The data is pretty messy, not particularly, the transparency rules are not particularly well enforced at this point. But we haven't heard a lot about that from the Biden administration yet. Transparency, antitrust, mechanisms to make the market work better. What are the prospects for that?
I mean, I think that the transparency piece is crucially important, but in order for it to work right, I mean, Larry, you've hit the nail on the head. If you're going to have, for example, a regulation mandating certain kinds of transparency, you have to enforce it, right? I mean, the reality is that many institutions around the country didn't comply precisely because they knew it wouldn't be enforced. And they knew the administrations were changing over. So you're absolutely right. The data is messy, it's incomplete. And if we're going to go the way of saying, for example, that we have to have greater transparency around pricing at the acute care level, pricing sort of, up and down the entirety of the continuum of care, which, I, as a general matter, support, then I think we have to be serious about what government's role is in enforcing that transparency. You can't have it both ways. I think the employer community has done a great job of creating kind of interesting pilots. Some employers, for example, have been very good about giving their employee bases more information about the value of healthcare that they're getting. And that's all well and fine, but until you do it at scale, it's going to be very difficult to achieve the kinds of savings that you would expect from broader transparency measures. So I think transparency is a very good idea in concept. We've actually seen in other countries it can be effective. at least not from a strictly sort of causal point of view, but we have good correlative evidence to suggest that transparency is one of the reasons why we see lower per capita healthcare spend in some other industrialized countries. I think the challenge here in the United States is, first of all, what is the government role? And second of all, how seriously is the administration going to take the concept of enforcing the rules? And let me just touch on antitrust for a moment, because I do think that is a crucially important piece. There's actually going to be a hearing, I think, next week before the House Judiciary Committee on this very topic, or maybe happening, in fact, right now, now that I think of it. But this topic is very important, which is what is the proper role of the federal government as well as state governments in ensuring that we are providing for a competitive playing field. And in too many parts of the country, I mean, I live in the Bay Area, which is notorious for having anti-competitive acute care markets. Certainly it's the case that if you look across the country, there are plenty of examples of where, in my mind, we haven't been aggressively enough looking at the challenges created by certainly horizontal consolidation in many different healthcare markets. So I, for one, would love to see more investment, for example, in antitrust resources at the Department of Justice, as well as at the FTC, to ensure that we are doing the right thing when it comes to creating and fostering a competitive marketplace.
Yeah, and certainly,
Larry-
HHS Secretary Becerra, led some of the efforts to stop some of those anti-competitive practices in the San Francisco Bay Area, where I am as well. Elizabeth, is that, employers, I assume would be reticent to invite government intervention into, anti-competitive practices in their own businesses, but are they comfortable, you think, in the healthcare context?
I think so. We were one of the initiators of the Sutter suit because people were overpaying and they could not get the transparent information. They couldn't make value-based arrangements. And, the settlement showed that they overpaid by $576 million. That was the settlement number. So we do need to make sure that if we are going to have a private market, it functions like a private market. Transparency, accountability, and really being responsive to its customers. So we do think that that is a very important agenda for the Biden administration. And we know Becerra is very familiar with some of the practices, and we hope that the industry becomes more responsive, because again, they got billions of dollars in taxpayer funding, and everybody wanted to make sure that frontline clinicians, doctors, nurses, social workers had the resources they need to fight this pandemic. But for hundreds of billions of dollars of taxpayer money, they need to be responsive, and they need to meet the needs of Americans and patients and businesses.
And Chris, what do you think? The Biden administration has been drinking from a fire hose.
Yeah, that's what I was just saying. When you asked the question, you haven't heard from the Biden administration on this issue. What issue haven't you heard from the Biden? There's so many. But I'd say this, that there's no indication that they're not moving ahead on transparency. As you said, the secretary is very much committed to that end. The issue you all raised appropriately on the lack of enforcement is much to do with what penalties the Congress authorized than anything else. The dollar penalties are very small, so even if they apply them, there's lots of indications that the hospitals will just pay the fines. So, if the Congress wants to provide more power to the secretary to enforce, I'm sure that he would gladly embrace that policy. Moreover, I'd say that as a whole, I think the administration will support, which is more Justice Department and FTC, more resources for antitrust enforcement. We're seeing across the board a real concern about consolidation in marketplaces, but in particular in hospitals. It has to be done in a targeted, thoughtful way, of course. And I guess one thing that I would say, just having witnessed this debate for 30 or 40 years, antitrust enforcement can generally only go so far, and you probably have to start thinking about some of the prices differential. And now I'm going to just go full circle, Larry, back to the issue, which is the biggest beneficiary of transparency are probably the purchasers, i.e. employers and plans. Consumers getting a lot of that information, it has yet to be very extraordinary, either user-friendly or used that much by consumers. But by the larger purchasers, they're seeing this huge disparity between what they're paying and what Medicare is paying. And I think that now is starting to drive a broader issue about how can this be?
So that touches on some questions we've gotten from the audience as well. There is this tremendous focus in Washington right now on drug prices, and as Lenny said, on a bipartisan basis. Not a whole lot of talk about hospital prices, which frankly are many times the driver of healthcare costs as drug prices are. Why do you all think that is?
Well, I think drug pricing, because prescription drugs are so widely used, because so many Americans, have regular access and regular need for them, it's just much more of what I would term a kitchen table issue than what you would see on acute care prices, which you're absolutely right, Larry. If you look at it, it's multiples. It's not even close in terms of what's actually driving the cost now, and has for some time. So I just think some of it's an element of proximity and just the widespreadness of prescription drugs and prescription drug utilization versus interactions with the acute care system. But unquestionably, this is one of those things where locality and as Tip O'Neill used to say, all politics are local. I think all healthcare is pretty local too, in the sense that you've really got to look at what is happening in individual markets, and that's why state activity can be just as important, if not more important, than what we're seeing at the federal level. So if anything, if we're going to raise attention on the question of prices, not just with respect to prescription drugs, but more broadly across the system, it has to be an effort that happens at the state level as well.
Yeah, I just want to say also that I think provider pricing is hugely problematic. And we saw it in the surprise billing debate, and everything from air ambulances to emergency rooms. And as those prices become more transparent, they become more noticed and focused on. And we are seeing hospital prices in some states, at 500, 600, 700% of Medicare, when research shows that hospitals should be able to manage at 160% of Medicare max. So we are starting to have a lot of attention paid to hospital pricing. And that's one of the reasons that the transparency requirements are so important.
So we've got a lot of questions about coverage as well as costs, fixing the family glitch in the ACA, people losing their jobs and losing their coverage, employer-based coverage during the pandemic, switching from an employer-based system to a more public system like Medicare for All. We've been talking a lot about costs. Here, how much of the debate in Congress do you think in the coming months is going to be focused on coverage and reducing the number of uninsured, and how much is going to be focused on these cost issues that we've been talking about?
Well, I don't think it's an either or, Larry. I think, in fact, it's an either and it has to be, because there is a great demand to address many of these issues of costs and coverage across the board. There's no lack of appetite or lack of creativity for ideas in this area. But I think clearly already the president has both enacted the law and has intended and signaled his intention to make permanent the ACA improvements that were part of the Affordable Care Act's enhancement in the rescue package. And I think probably he seemed to be signaling actually enhancing those going forward. He also has indicated with great passion the whole issue of the 12 to 14 states who have not expanded Medicaid to date. It really is a moral imperative and a blight that we have people living in poverty who have no health coverage because states have not expanded coverage. And so I absolutely believe that will be a high priority, as will addressing some holes within the Medicare program, some of the lack of benefits that have been covered for years and years. People think Medicare is a Cadillac benefit, but we all know that it, for the fee-for-service programs, offered no no catastrophic coverage, no hearing, no vision, no dental, etc. There's lots of interest in moving in that area. Lanhi mentioned the Medicare 60 policy. There's absolutely interest or some down payments on public option, whether that is for the Medicaid population, whether it's for the Medicare population, that certainly will be debated going forward. Many of the issues that I've just laid out, though, Larry, are not issues that I think Lanhi could probably honestly say are high priorities of the Republican Party at this moment. And so this then gets to the issue of on what vehicle and in through what strategy you will be including that policy. And then, of course, if the offsets from drugs are part of that, then you have to think about the packaging of this. It's too early to say exactly how that will work, but there's absolutely no diminution of the passion that the Democratic Party has for expanding coverage.
Yeah, I
So-
mean, look, I would just add briefly, I think that there are a number of things that we've already seen passed into law that are meant to address directly the coverage question. I agree with Chris. There are still holes that need to be filled. And I also agree that coverage and cost have to work together. It's very difficult to do one to the exclusion of the other. Look, I've worked with Democrats on proposals that look at how we can get at Medicaid expansion in some of these states that I think arguably both sides could say they didn't get 100% out of it, but they got something they wanted. That kind of flexibility, I think, is very important. Unfortunately, I will say so far, at least, the administration has not seemed all that interested in the meet us halfway approach when it comes to Medicaid. And so I would hope that if that's an area they're very interested in looking at, they would entertain the concept of greater state flexibility and working with Republicans to get there, because I think there is a way to bring expansion to a substantial number of the Medicaid eligible and create potentially a more stable benefits platform for people at the lower end of the income distribution. Because one of the big challenges now we have is you got people rolling on and off Medicaid. They go off Medicaid, they pick up some employer coverage for part of the year, then they go off and go on Medicaid again, and they end up in a very difficult life situation. So we should be figuring out a way to create more stability, I think, for folks who have those challenges. But again, these are things, I think Chris and I we could sit down in a room and we could agree on 95% of how to get this done. It just really becomes a question of politics at some point and the polarized environment we're in.
So Lenny, let me ask you, the American Rescue Plan introduced a pretty substantial additional fiscal incentive for states to expand Medicaid. Our analysis shows that at least over the first 2 years of expansion, every non-expansion state would effectively get paid to expand by the federal government, and then have to pay 10% of the cost after that. How powerful an incentive do you think that's going to be for states?
Yeah, and what I've concluded is this is no longer a fiscal conversation. The fiscal incentive is very clearly there. If a state wants to take the fiscal incentive, they should, and they will benefit handsomely from it. But what it has become is a broader political conversation around the direction of the healthcare system in these states. And the political reality for many of these governors is that a full-on standard Medicaid expansion is going to create significant challenges for them, substantive and politically. And so that's why having some kind of third way that isn't no expansion or full expansion, but takes advantage of some of the elements of the law that exist, again, to build a more steady platform, ideally for people who have to go in and out of Medicaid coverage, that I think is the way forward. Because what has become clear to me is that you can throw as much money as you want. And now maybe at some point you throw enough at them and they'll say, fine, we'll take it. But what's become pretty clear to me is that is not the key trigger point for most of these governors. So you can make all these promises about fiscal benefits. That's not going to be enough, I think, at the end of the day.
Well, as Lenny said, this debate is about a political debate about the future of the healthcare system, and that I think is as good a description as any of all the issues we've been talking about today. We're unfortunately at the end of our hour. Thanks to the panelists, thanks to all our speakers, thanks to all the participants in the audience. It was a great session, and it was being recorded and will be available. And we'll send out a note to everyone who registered when it is available. But thanks again for a terrific discussion, everyone.
Thank you.